So, creatinine clearance provides a more direct measure of renal filtration. The test requires both a 24-hour urine collection and a blood sample for serum creatinine, and the result tells us the rate at which creatinine is removed from the blood, typically expressed in milliliters per minute. Because muscle mass and body size affect creatinine production, values are corrected for body surface area using the patient's height and weight. This test is really useful when a precise GFR estimate is needed or when eGFR might be an unreliable measurement. So, how do you actually get a 24-hour urine sample for a patient? When you're ordering a 24-hour urine test, patient education is essential. On the first morning, a patient voids into the toilet and then collects all urine for the next 24 hours, including the first morning urine of the second day. The specimen should be kept refrigerated to prevent bacterial growth and labeled with name, date, and time. Incomplete collections are a common reason for inaccurate results, so be sure your patients understand that missing even one sample could invalidate the test. They are carrying a jug that they are peeing into the whole day. So ideally, we try to do this on days where patients don't have to go anywhere, but sometimes they might have to carry this jug with them. The creatinine clearance formula combines urine creatinine, urine volume, serum creatinine collection time, and it gives us a plasma volume cleared of creatinine per minute. This method tends to slightly overestimate a true GFR by about 10% because creatinine is also secreted by the tubules. When GFR falls below 30% of normal, the secreted fraction becomes disproportionately large and clearance results become less reliable. So while creatinine clearance is a good approximation, it is not perfect. Now, creatinine clearance will normally decline with age, about 6 to 7 milliliters per minute per decade after 20 years old. Normal values are between 90 and 139 milliliters per minute in individuals assigned male at birth, and 80 to 125 in individuals who are assigned female at birth. This decline reflects the gradual decrease in nephron number and glomerular surface area over time, not necessarily related to any disease or dysfunction. And it's an important reminder that our kidney function is relative to age and body size. Several factors can affect creatinine clearance values. Exercise can transiently increase serum creatinine, while pregnancy raises urinary creatinine excretion. Incomplete urine collection, which valid, gives a falsely low result, one of the most common sources of error that we see with our patients. Certain medications can also interfere by altering renal blood flow or tubular secretion. So when results don't match the clinical picture, always verify that collection and timing were done correctly before assuming any pathology. Cystatin C is another marker for estimating GFR that's gaining more popularity. It's a small protein produced by all nucleated cells, freely filtered by the glomeruli and metabolized in our proximal tubules. Because it's independent of muscle mass, age, gender, and even race, cystatin C is especially useful in patients where creatinine-based estimates might be misleading, like those with cirrhosis or muscle wasting. Normal adult values range from roughly zero point 0.5 to 1.55 milligrams per liter, and it's considered superior to serum creatinine for certain patients. When we come back, we're going to look at kidney failure and stages of kidney failure.